Hello, my name is Marc Gottlieb, and I'm here today at the Greater New York meeting to talk to you about the MoJo II dental impression syringe. The MoJo II dental impression syringe is a dental impression syringe that's going to save you about $2 every time you take a dental impression. Typically what a doctor will do, he'll take a polyvinyl cartridge with a mixing tip on the end. This mixing tip costs you about $1.50. Then you have to place a nipple on the end to redirect the material down into the sulcus. This material waste and the tip itself will save you about $2. The MoJo II syringe, as you can see, is about the same quantity or the same amount of material that you're going to waste that's already in the mixing tip. What I'll do is I'm going to take Danville's first half material. I'm going to mark the spot where we're starting so you can see that we're virtually using hardly any material at all. Now, I don't smoke, but I watch a lot of movies. So I'm going to take the MoJo II, just like I would hold a cigarette, right up to the cartridge gun. It sort of fits in place but doesn't lock in place. I will give it a light squeeze, fill it about 2/3 of the way, and that allows me to have room for my plungers. I will take the plungers, load that in the back, and then I'll switch this little cap to the number 2 position. By rotating it 90 degrees, I'm in the number 2 position, so that prevents me from accidentally mixing it into the mixing tip. So I can preload this when I look at the patient's schedule and I notice I have a crown or bridge selected for the day. So I can use it now, I can use it an hour from now, I can use it next week. The tip at the end of the MoJo II syringe is the same diameter as number 2 retraction cord and also rotates 360 degrees around. So I can place it into the sulcus without having to worry about the access to the sulcus itself. Typically, a dentist will take a cartridge gun with a tip on it and try to inject it into the sulcus, and has a little bit of a tremor. It's very difficult to keep it in the sulcus and stay within the lines. With the MoJo II syringe, once it's loaded, you rotate it into the number 3 position like that, breaking the membrane, and that allows you to easily redirect the tip and stay within the line. So I can take this, and now I'm going to literally, as fast and as hard and as quickly as I can, fill up the sulcus, and I have enough material now to take an impression for a 3-unit bridge. So if you look at the MoJo syringe, I have enough for 3 units, possibly 4. If I'm doing a larger case, what I'll do is I'll select StarFlow, which is a 4.5-minute set, and I'll fill up 2 or 3 syringes and just use what I need. So in comparison, we have a mixing tip which has the same volume as the MoJo II. When we look at the amount of material we actually use at the cartridge, I'm going to get between 35 and 50 impressions out of a light-bodied cartridge, depending on how many units I'm using. Once again, thank you for the time to allow me to introduce the MoJo II syringe. We're going to save $2 to $3 every time we switch from a mixing tip to the MoJo II. It's a nice, easier way of taking dental impressions. If you're 90% successful now, you'll go to 95% success rate. Think about it. Those 5 patients that you're more successful with, they're going to appreciate the fact that you don't have to take it over. The dental assistant's going to be happy because she doesn't have to set up again. She can text 5 of her best friends. And the dentist also is going to be thrilled because he now saved $12 to $15 every time he doesn't have to take an impression over. Thank you again.